Hi, I'm Jude from @Jude Reborn Girl. I'm so excited to be back to address a topic by popular demand. I run a group on Facebook. It's all about facelift. It's called Facelift 101. I also have a channel on YouTube that you're watching that is focused on facial plastic surgery. And this topic comes up over and over. Many women aren't sure. They're struggling with the decision as to whether they should have a CO2 laser, a skin resurfacing treatment with their deep plane facelift. Many plastic surgeons today are recommending that you have the two together. Of course, not all. There are plastic surgeons that like to split them up, but many are recommending that they have them together. Many women in my group and on my channel have successfully had them together, and they look amazing. I had 5 facial plastic surgery procedures just almost 2 years ago. It will be 2 years in a few months. I recently turned 70, and now I'm about headed towards 71, and the experience was fantastic. It took decades off of me, but I did not have, and I guess I did not need, a CO2 laser treatment, even though my plastic surgeon does offer it. So I am not speaking here from experience. I'm speaking here today from research and from a lot of anecdotal feedback that I've received from women that I interact with daily. With that in mind, we are going to talk about what is a CO2 laser resurfacing treatment. What does it do? What are the benefits? And what are the downsides? What are some of the risks? How do you recover from a CO2 laser treatment? And how does that work along with your recovery from a deep plane facelift? And I'm going to try to incorporate all of these small questions that I've gotten over the last few months about this. But if you have any additional questions after you watch to the very end, then please don't hesitate to leave comments and or come into my group and shoot me a direct message. So let's dive in to CO2 laser.
So, what is a CO2 laser, and exactly how does it work? A CO2 laser is a tool that healthcare professionals may use to treat irregularities and signs of aging on the skin. CO2 lasers emit energy of a wavelength of 10,600 nanometers. Water within the skin cells absorb this type of wavelength, resulting in the ablation of the superficial layer of the skin. This treatment produces a type of heat injury, which stimulates the skin underneath it, resulting in the formation of collagen, which is a protein in the body that provides a tightly organized fiber network and contributes to the skin's elasticity. As the skin begins healing after the treatment, new skin begins to form that may be smoother, tighter, or more elastic. All in all, younger. CO2 lasers come in 2 different types, ablative versus fractional. Ablative involves vaporizing the skin tissue. This treatment is more aggressive, but because of this, may produce more dramatic effects and visible skin improvements. Fractional CO2 laser treatment involves the application of a large number of microbeams, which are more targeted in nature. They utilize columns of ablation through the skin while leaving the surrounding skin undamaged. Fractional CO2 lasers minimize the risk of adverse effects due to being so targeted. And this form of laser treatment does offer a faster recovery time. When combined with a deep plane facelift, a fractional CO2 ablative laser is most commonly used as it effectively treats deeper skin layers while still providing a relatively shorter recovery time as compared to a full ablative CO2 laser. And fractional CO2 lasers create tiny micro perforations in the skin, allowing the laser energy to reach deeper layers and to stimulate collagen production, which is ideal for addressing wrinkles and skin texture concerns that are often associated with a deep plane facelift.
The plastic surgeons see the two of these together as just a very comprehensive approach to facial rejuvenation. The CO2 laser treatment addresses surface irregularities and takes care of issues with skin quality, with skin tone, and with skin texture. So, in other words, if you go in for your consult and the plastic surgeon notices a lot of sun damage, a lot of fine lines, wrinkles, the skin quality is no longer fresh, it's dry. On the other hand, if you go in and you're standing together looking in the mirror with your doctor and he sees that the shape of the face is tending to be more square because the face has fallen and you've developed the jowls, he is going to want to do, or she is going to want to do, a deep plane facelift on you, because that's going to help repair and lift the musculature, the anatomical structures of the face, and lift that musculature and bring everything back up again and have it replaced and repositioned where it used to be decades ago. And so, besides taking care of the drop and the fact that the face, due to gravity and aging, is lower and has a different shape entirely than it used to, adding in the CO2 laser treatment can concurrently take care of smoothing that skin, giving you back that beautiful quality to your skin. I was a training director for cosmetic companies, and I was always staying out of the sun. I wasn't sunbathing. I was taking really good care of my skin. Well, when I met my plastic surgeon, he said, "Oh, your skin is really strong qualitatively. We don't need to do any laser or any peels. You already have that useful quality. You've maintained it." So I didn't need it. He didn't feel I needed it. And a lot of women have asked me, "Did you get it?" And that's why I didn't have one. However, you will be urged by your doctor, most likely, to have this treatment either before, during, or after your facelift if you have these issues. Also, if you have a lot of acne scarring and it's carried over into adulthood, that's another reason that they may suggest it. So, what are some of the great things that a CO2 laser treatment will address specifically? Fine to moderate fine lines, wrinkles, deeper wrinkles, sun damage, sunspots, acne scars, chickenpox scars, actinic keratosis, which is a flat, sort of dry, rough patch of skin, sometimes precancerous, and seborrheic keratosis, which can be a small, benign, wart-like tumor or growth. And all of these things can be addressed with a comprehensive CO2 laser treatment. I've noticed that the women that go into it with a lot of fine lines right under and around the eyes, a lot of lateral lines, women that have those pesky lip lines, upper lip lines, the lines between the cupid's bow and the tip of the nose. The CO2 laser treatment is fantastic if those are your issues. I have had many women write me and ask me, will a deep plane facelift get rid of the lines in my forehead, which I seem to have had for years? Will they get rid of the lines in my cheeks? Sometimes these lines. Fine lines, static lines, lines you've had for years, lines that are there whether you're smiling, laughing, crying. So while you might have used Botox to try to get rid of those, Botox is really, really good at treating dynamic lines, lines that occur when you're moving your face and you're expressing emotion. But CO2 laser is really great for zapping and diminishing static lines, really anywhere in the face, but especially those areas that I just mentioned. So that's exciting. You have to remember that side effects with any procedure have a lot to do with what type of health you offer up when you go into the procedure. Are you in good general health? Do you have ongoing health issues? Obviously, the healthier you are when you undergo any procedure, the better the results, the quicker the recovery.
So here goes possible side effects: infection, a delay in wound healing, scarring, skin peeling, skin redness, milia, those small yellow or white cysts that appear in clusters. Also, changes in skin tone. With this in mind, it's very important to make sure that you take time in your consult to discuss potential side effects given your skin type and your skin tone, because different lasers affect different skin tones differently. So make sure you talk to your surgeon about this. The skin typically requires 2 to 4 weeks to completely heal from CO2 laser. New skin begins to grow after around 2 weeks following your laser treatment. Now, initially, your skin will be quite raw and may have drainage after the treatment, and it may look and feel as if it's severely sunburned. Healthcare professionals will cover your skin with a mask bandage for several days. And while the skin recovers, you should consider doing the following to prevent damage to your skin. First, stay at home and avoid strenuous activity. Refrain from picking or scratching at the skin while you are recovering. You can use over-the-counter pain medication or ice packs to reduce pain, and make sure you minimize your direct sun exposure and use proper sun protection, such as a physical sunscreen with a zinc oxide base. And when you wear a hat, wear a big floppy hat, not a baseball cap. And make sure you attend your follow-up appointments to monitor your recovery, and of course, take any and all prescription medication that was prescribed for you. More often than not, surgeons will recommend having your facelift first, followed by a CO2 laser treatment to make sure that you have healed appropriately from your facelift. This allows your surgeon to address the underlying structural issues through the facelift and then use the laser to refine skin texture and appearance on your newly positioned skin. Performing the laser treatment after the facelift allows the surgeon to work with the lifted skin, achieving the best aesthetic outcome. However, combining both procedures can sometimes be done in the same surgical session, minimizing overall recovery time. And hey, you don't have to go through the discomfort, the pain, and the downtime more than once. Have I seen that? I have seen that done often. And with great results, I might add.
So all in all, many doctors will tell you that CO2 laser, when done correctly, can actually take off 3 to 5 years from your look. So if you're pretty young and you're not quite ready for a facelift yet, maybe you don't want to have a smash facelift, which some doctors do on women that are still in their 40s, and you'd rather wait to have a deep plane maybe in your late 50s, but you want to take off some years and get that fresh, youthful kind of, pop. I highly recommend the CO2 laser if your skin qualitatively and from a sense of maybe being uneven in tone could use it. If your skin has those symptoms, then I would highly recommend that you consider the CO2 laser. So I wanted to just say thank you for watching today. I appreciate it. I hope that I've answered all of your questions about deep plane facelift combined with CO2 laser, and that you feel more confident and more educated in making a decision as to whether or not you are going to go ahead and have your CO2 laser treatment either independent of a facelift or with a facelift or even after a facelift. I hope that we have been a good resource for you, but don't hesitate to shoot this channel some questions in the form of comments or even email. My contact information is below, and I welcome your viewership. I hope that you will like this if you got value out of it, and that you will talk about it and share the information with your friends. And don't forget to subscribe to this channel, because I'm always producing new videos with content that will hopefully inform and inspire you. And with that, I say thank you, and I'll see you on the next video. Ciao.